சுப்ரஷ்மி, செங்கோட்டையிலேருந்து வரேன். அம்மாவுக்கு கீழே விழுந்த ஆப்ரேஷன் பண்ணுறதுக்காண்டி வந்திருக்கேன். கீழே விழுந்தப்போ கவர்மெண்ட் ஆஸ்பத்திரியில் சேர்த்தோம். சேர்த்து மறுபடியும் தென்காசி கவர்மெண்ட் ஆஸ்பத்திரிலையும் சேர்த்து இப்போ 8 நாள் கழிச்சு இந்த பல் இது போட்டு கம்பி போட்டாங்க. கம்பி போட்டு கொஞ்ச நாள் கழிச்சு அவங்க சரியாக இது ட்ரீட்மெண்ட் கொடுத்துட்ருக்கும்போது நான் இந்த கொரோனா வைரஸ் வந்ததுனால எனக்கு உடம்பு சரியில்லை. நான் வீட்டில் இருந்தேன். உடனே அம்மாவும் பார்க்க கால் இல்லாமல் வீட்டுக்கு அண்ணே டிஸ்சார்ஜ் பண்ணி கூப்பிட்டு வந்துட்டான். இங்கே தனியாரில் பார்க்கலாமேன்னு கூப்பிட்டு வந்தேன்.
Hi, we are about to start surgery for this patient who has had multiple mandibular bone fracture, lower bone fracture, lower jawbone fracture. So she has a very interesting story. We are helping her out. She had this fall a couple of weeks ago and she had gone to the local government hospital, which is not very far from here. Out there, they did the conservative treatment. You can have a look what's done. So they've put some arch bars, as we call, like bands, and they put some bands here, they put some elastics. Why, Turgama? She can't open her mouth. And more importantly, you see how her teeth is? So none of her teeth are in what we call as an occlusion, which means this is absolutely no good for her. She won't be able to chew her food. She's not going to have any possibility to do that in the future as well. Currently, she also has pain in both two areas, and I've got the CT scan which was taken at the government hospital when it happened. You can see the fracture, it's lying there, one fracture, and the other fracture on the other side of the jaw. So you have two fractures running like this. Now, what's interesting about this patient is the current government setup where she's come from, they have earmarked, they have kept a lot of beds for the current coronavirus scenario. So they're not going to do these kind of patients. So she was just done this procedure in the local anesthesia and she was asked to go home. She was at home for 10 days, also be having the lockdown in India, but she also had severe pain and with difficulty. She was referred over here by another doctor. We're helping her out at this time. We're going to have all our PPEs in place. She's otherwise asymptomatic. She's got no other issues, just this. So we're going to get this done under general anesthesia today. We're going to take adequate precautions as they be. And I think the beauty is that even the private setup, we people should help these patients at this times of crisis, because otherwise they would go to a malunion or a non-union, and that will have a lot of issues with the patient's ability to live any quality of life. So that's the reason why we decided to do this patient today. And it's going to be a procedure that we're going to do from inside the mouth under general anesthesia. This is the cone beam CT scan orthopentomographic rendering of the same patient. You can see one of the fractures that's running through the symphysis or the center part of the lower jaw. There's another fracture here, you can appreciate as I zoom it. So here it's coming between the wisdom tooth and the lower border. There's a displacement as well. And so we'll have to work and reduce this. This is not that badly displaced, so wouldn't need that kind of reduction, but still some fixation will be needed. And this is the 3D rendering now. And you can see there is a tooth on the line of fracture. We call it line of fire. Anyways, and that's the symphysis fracture. We're going to do open reduction and internal fixation of both these fractures. Open reduction and internal fixation of this mandibular fracture. Patient sustained this fracture a couple of weeks ago. They have done some conservative treatment elsewhere. This was also done about 2 weeks ago, but it's led to totally non-existing occlusion, which means the patient is not able to open the mouth, not able to chew, nothing. It's not functional at all. So I'm going to have to remove these arch bars and get the proper occlusion. Patient has 2 fractures. One running like this, another one running like this. So I'm going to try and fix both these fractures from inside the mouth. see there's a step deformity. So this segment of the mandible has to come out. But what has happened is they have kept it at this position and fixed it here. So I'll have to cut the wire there if I'll have to move it around. Otherwise, it's absolutely difficult for me to move it. So I'm just going to have to clip it here. Yeah, so now by doing that, I can have this part of the mandible. You see the fracture runs all the way up between the canine and the lateral. So now I've made it into two separate pieces. So that's the real mistake the earlier surgeon has done. Of course, they haven't done an open method. We'll have to reduce this by moving the segment out. So you can see we've reduced the mandibular fracture now. That was really hard. I've used the Pospillo's bone hook for reduction. I haven't got good occlusion yet, but I want to fix this because we've got perfect reduction now. We're going to fix it with 2 4-hole plates, and then we're going to take it forward. On this side, you can see the plate right at the bottom of this one. Yeah, that's much better. Anyway, so we've also gotten off all the arch bars that were in there, wasn't placed correctly. You see, these are plates that are bent to adapt to the shape of the mandible there. So this comes out of a lot of experience, but nowadays you can also get it pre-bent with some computer softwares. One plate here, I had to reduce the fracture, remove all the wires that were put in. You can see the incision is all the way from here